process of using small appliances, little wires, brackets, small trays, all that are designed to take teeth and gently move them from where we don't want them or where they look badly to someplace closer to where they belong and function better and look better. That's all it is. For orthodontics, we use a number of different types of things. One of them we use are going to be appliances. Little appliances, these tend to be removable items, although they can be glued in some cases, if kids won't keep them in. Or adults for that matter, they're designed to do things like expanders. A lot of times people's arches are just way too narrow, so we need to make things wider, make enough room for those teeth to fit. Those are expanders, those are a form of appliances. They also have a lot of other functions. Some of them are designed to set the way your teeth fit together, etc. For the standard braces, we get into what are called brackets and wires. Brackets used to come in one color, silver. That was it. That's the only choice you had. Now they come in tooth color, they're a white color, they're clear, or they're even gold, which amazingly enough is not quite as visible as the standard silver ones. The other method to do that is what's called Invisalign, which is where we use a clear plastic tray that you wear pretty much 24/7 except for when you're eating. You do take them out to eat. And you wear each tray for about 2 weeks, and then you switch to the next one. And each tray is designed to gently move that tooth just a little bit. You put the next tray in, it moves it just a little bit more. And essentially it's the same process, a little different way of making it happen, however. The big advantage with them, you don't have any brackets, and when you smile, it's very, very hard to see them. That's why they're called Invisalign. So they're invisible. The amount of time you use to do this can go anywhere from 6 months to a couple of years. And cost-wise, you're going to go anywhere from around $1,000 up to around $6,000. At least that's the prices here in Columbus, Ohio. Early treatment. You'll sometimes see ads in the paper saying you should have your child examined by the age of 7 or so. This is true. One of the things that it does happen is frequently, if we see your child early and we can see some of these problems coming down the road, we can sometimes use a small appliance to help, like an expander, to help correct some of those issues, and or to make the next phase of things where we're going to have to do use the braces, etc., or even the Invisalign for teens now. They can minimize the amount of time that you're in the brackets and or make it a little cheaper to do that down the road because it's not going to take quite as long. So early treatment is, or sometimes known as two-phase treatment, is definitely a good thing to have happen. And we like to see kids probably around 7, 6, somewhere in that range, we can start to see some of this stuff develop. Airway. I want to talk about an airway just for a minute. In the last 5 or 6 years, the research is showing that a lot of the orthodontic problems that we see are essentially growth and development problems that happen because the airway is not working the way it's designed to do, and that starts even as young as age 3. So we're looking even at kids that are 3 and 4 for this kind of an issue. If you can't breathe, you've got through your nose, then your mouth hangs open. Your tongue is not up there when you swallow during that time. It's not pushing that open and out, so you get a very narrow top arch, and you look like this when the kid's 12, and that's a problem. But airway, there's 3 spots where we can cause a problem with that. The first one, obviously, is the nose itself. If the air openings in the nose are too small or the septum's all deviated, that's an issue. The second place where we have an issue there is what are called adenoids. The adenoids are the little tissue in the back of the throat, right behind the nose. And they're pretty much done, according to medical science these days, by around about age 2, and after that they're just kind of sitting there taking up space. When they do, they cause 2 problems. Number 1, they can cause some swelling, and they happen to be right in that area where the ear canals come in. Now, if your child has had an ear infection, it might possibly have been caused by the fact that that adenoid is now plugging up the end of the ear canal, and it doesn't drain, so all the stuff sits in it, gets infected, and your child starts to have a lot of ear infections. If your little child is like mine, when they start to have one of those, it's usually at night. They keep you awake. You're up, they're in pain. You feel horrible because you can't do anything to help them. And unless you've saved one of those little tubes of topical anesthetic for some point from your last ear infection, this child's going to have a horrible evening, and you feel terrible. But they'll cause a lot of those. Next spot down is the tonsils. If they're too big, obviously you can't breathe through them, you can't swallow through them very well, and they take up way too much room, and they need to be removed at some point. Um, the symptoms that you're looking for in a child, if you want to kind of self-check your child, if you'd like, you're looking for little blue circles under their eyes. That's caused by the fact you're not getting enough blood flow back through there. You're looking for the fact that if they snore, I'm sorry, a 5-year-old child should not snore. And neither should a 45-year-old child either, but that's another issue, and that gets into sleep apnea and a bunch of other stuff. If your child grinds his teeth, kids at 5 years old are not stressed. They're not supposed to be grinding their teeth either. If he's sleeping on, takes 2 pillows to sleep on. If you see him when he walks around and he's got his head kind of pushed forward and the head tilted back, he's trying to unconsciously open that airway a little bit to breathe a little better. Those are all signs that we've got some kind of an adenoid tonsil problem usually, and airway needs to be opened up a little bit. When that happens, they'll grow and develop better, and you may not need as much in the way of orthodontics down the road. At least this is what the research is now showing us in the last 5 years. So that's kind of the subject of braces. Move teeth where they need to be, gently and easily, so that they look where they're supposed to go and function the way they should. So if you have any questions, you can obviously call our office or look on the webpage, which is the banner, which is across the top of the video, and we'll be happy to answer any questions you might have and or do any evaluations for your child. Thank you.